My name is Peter Schmid Grendelmeier. I'm the head of the allergy unit of the Department of Dermatology in Zurich, Switzerland, and I'm serving as the Vice President of Education and Specialty for EAACI.
What are some of the most recent and important developments in your field?
In the area of allergic skin disease, I think there's the increase of atopic dermatitis, which is a global problem, and the other is the rapid increase that we see in some contact allergens that really cause contact dermatitis to substances that are highly prevalent in our daily life but cause severe skin diseases.
What are the main priorities for Europe in the field of dermatology-related allergies?
There are several priorities. First of all is to spread out the impact that allergic skin disease has of the general public. Usually they are not killing disease, but they have a huge influence on the quality of life of our patients, also of work loss, so economic burden, and of course psychological factors. If you have a skin problem in your face, it affects your daily life. For allergic skin disease, we need a multi-professional approach. So the role of allied health professionals is very important for patient education, for doing allergy tests, also to show them how to use emollients, for example, how to avoid allergens. I think we couldn't do a proper job without allied health in that area.
What should be the steps, for example, in banning and monitoring substances that induce contact allergy at a European level?
Oh yeah.
What's going on right now with legislation for this?
We have some contact allergens that are so common in daily detergents and so on that they somehow provoke an epidemic of contact dermatitis. And we have to alert this not only to the public but also to health policy providers and authorities on a European level even, that these products are either banned or very clearly defined to be avoided.
What is the road towards prevention, and does precision medicine aid in prevention?
Prevention is crucial in allergic skin disease because some are caused just by external allergens, so it can be fully prevented. We also have to use like gloves and others to prevent occupational skin diseases. Nowadays, I would say precision medicine is not so much arrived yet in the prevention of allergic skin disease, but one day it will be very important to know exactly the patient's, let's say, sensitization pattern, to know what he should avoid, for example, what occupation is allowed to, what cosmetics is allowed to use. It's a big problem if you have a skin disease that is due to your job, so you have an occupational skin disease, because it affects your work. You are not as good at performing your work, and you have to avoid some activities. That means that some of your colleagues think you're just lazy or you don't really cooperating. But it's very important to detect this occupational skin disease properly, to make a good diagnosis and to make good recommendations, also to avoid further damage on the skin or on other organs.
What is the importance of educational programs to train patients who live with atopic dermatitis and other skin allergies?
Educational programs are so crucial, especially in atopic dermatitis. They help to deal better with the disease for parents or also patients. They help to prevent exacerbations, they help to reduce the drugs that you use, and they help even to reduce costs which are related to these diseases. So there are very good studies proving that education in AD is really absolutely crucial. It's a somehow cheap way to have a big impact on a very expensive disease with a huge impact on quality of life. Skin diseases are often looked at as not so important, so this affects also the training programs and attractivity for young colleagues to go into this area, especially when it comes to research. However, it's very important to offer them well-structured training programs, also research opportunities, because there's so much to do for allergic skin diseases, to find out the pathophysiology, to improve the treatments, to improve patient care, and it's a huge area which is very much boosting currently, and we need to show this our young residents and trainees. EAACI has a very important task to improve the education for our junior members, as we have many in the JMA, and we have so many good tools. We have, of course, the big meetings, but we have the allergy schools, we have the master classes, but we could also work on interactive measurements to improve education on a modern technology, so that people really learn a lot within EAACI that has to offer so many facilities which maybe national society or local hospitals cannot offer.